It's a small world, and I'm here every Tuesday answering your dental questions. Today we're going to talk about how long should dental work be okay without a problem. How long can it go since you've had work done at your dentist and you have a problem that you can expect to go back and say, hey, I had this work done recently. What are you going to do to help me? I'm going to tell you more about that at the desk. See you in a minute. Oh, hello again. So I was just telling you on the bike about how long you should expect your dental work to last. And I think the word warranty is a little out of place. If you buy a car, there is a factory warranty. If there is a problem with some mechanical issue in a very short amount of time, or even a pretty long time with some of these warranties, you can bring it back to the place you bought the car, and they will fix it. And your car, you're driving around, you're using it. It's not something that's just sitting, accruing nowhere. Kind of the same thing with your teeth. If I do a filling for you or a crown for you, every time you eat, you put 700 pounds of pressure on this tooth. Wear is part of the process. So how long should you expect work in your mouth to last? And I think a lot of people really want to know, hey doc, if I'm going to put money down and spend time, effort, money fixing this tooth, I want some expectation that it's going to last. And if there's some problem in a short amount of time, that you're going to help me out, that you're going to stand behind your work. And I will often tell patients, I stand behind my work. If you have a problem in a short amount of time, I want the opportunity to take a look, and if there's some reasonable thing that I should do, I would like the opportunity to do it. I'm hesitant to say there's a warranty, though, because this is a bit of a loaded word. There's some legality with it. So I'd like to start by telling you statistically how long restorations should be expected to last. Now, the first part of this discussion is that if your tooth had a problem and needed fixing in the first place, there's a reason for that. And if you treat your tooth exactly the same, then you can expect the restoration to also have the same problem that the original tooth had. That being said, if you remove the risk factor that caused you the problem in the first place, the restoration has the potential to last a lot longer. Now, I'm hesitant to tell you that a restoration will last a certain amount of time. However, I'm happy to do what you can do, Google, and tell you what the current numbers are. So when I head to my computer, a crown statistically will last 5 to 15 years. And it's funny how they've made the long number the big, bold one. Now, this includes crowns that have a problem from the get-go and don't last any time at all. And they also include crowns that someone takes really good care of and last a lifetime. It's rare for a crown to last a lifetime, though. Statistically, I had told people in the past 7 to 12 years statistically. But if you take care of it, then there's no telling how long it can last. How long do fillings last? The first thing that pops up on Google is that gold fillings last the longest, anywhere from 15 to 30 years. People don't get gold fillings anymore. It's very expensive. Silver amalgam fillings can last from 10 to 15 years. That's true. There are some silver fillings in patients' mouth that I see on a regular basis that have been there for decades. If taken care of, they can last. And if the same tooth is not going to be taken care of very well, sometimes a silver filling, an amalgam filling, can last longer. Why? Well, I don't want to get too much into it this video, but it's because of the corrosiveness of the filling. It's antibacterial, so if bacteria gets between the filling and the tooth, it is much harder for that bacteria to really cause a problem. A lot of bacteria have to die before enough bacteria can get in to cause a problem. Composite resin fillings, it says, doesn't last as long. You may need to have them replaced 5 to 7 years. I would say most of the composite fillings that I see last a lot longer than that, but there's a wide range. Patients who continue to not floss and needed the fillings because they weren't flossing in the first place and or they were sipping on sugary beverage or eating lots of sugar, they tend to need the fillings more often. If someone needs a filling between their teeth because they are not flossing and because they're sipping on sugary beverage, and they have me do a filling for them, and they continue those two things, they don't floss, they sip on sugar, the filling really only has the potential to last a little over a year, maybe 2 years before it needs replacing. However, if the filling is taken care of, if it's flossed, and sugary beverages are not sipped on, that filling has the potential to last years and years and years. Have I seen composite fillings last decades? Yes, but I'm hesitant to say that you can expect decades out of your filling because so many people need the filling in the first place because they didn't take good care of their tooth. They continue that risk factor remains, and so the restoration has the same trouble the original tooth had. All right, now let's talk about dental warranties. When I put in dental warranty, I got two interesting things that popped up that I'd like to talk to you about. The first is this company that I know nothing about, but in very vague terms, they talk about how you can buy a policy from them and insure your work. If you have a problem in a certain amount of time, they will pay your dentist or another dentist, if you're in another part of the country, to replace the work. Now, I'm sure that that's very similar to car insurance, where if you get in an accident with a car, it will be taken to a body shop, and the insurance wants to spend as little money as possible. They have negotiated that the body shop will do the same work at a much lower price. And you have to wonder, if they're getting paid a lot less, are they doing the same quality work as if someone pays them the full amount? Now, in dentistry and medicine, the doctor takes an oath. We are obligated to do our best for you. Financing doesn't really come into play. In some places, that is a problem. And I would caution you, if you're going someplace and paying the least amount of money, if you're seeing an ethical doctor like me, if I get paid a lot or little, I do the same high quality work because I feel it's important to do a quality job for someone. But if you are seeing someone and they are unfortunately weighing, well, I'm getting paid this much for it, I'm going to put that much effort into it, this can be a problem. The other interesting thing that popped up when I searched dental warranty was a big corporate dental office, which is nationwide, and they talk about the warranty they have on dentures. I'm not really sure if you pay extra money for this or if it's built in, but they have several tiers cost-wise of prosthesis, removable prosthesis, and they warranty it for a certain number of years. I think that's very interesting. Now, if someone does a denture with me, I tell them, if you have any problems, come back. And I have patients that need sore spots adjusted. When you put an appliance in the mouth, the gums are very sensitive, and invariably a few adjustments are needed. That's totally normal. But I haven't had anyone come in, let's say a year after. I dropped my denture and it broke. What can you do for me? I would charge them a repair fee, send it off to the lab, have it properly repaired. There would be some small charge, though. Not nearly as high as making a new appliance, but not a few dollars either, whereas this large corporation has made the decision to get people in the door by offering a warranty. If you drop it or something like this, they'll replace it. Now, they put in front of warranty limited, so I'm sure there's some restrictions on that. Maybe in fine print it says if you drop it and you broke it, it's on you. I don't know. They don't have the contracts visible online. But I hope that gave you some helpful information about how long you should expect your restorations to last. I think the bottom line is that when you sit in a dentist chair and you have a problem that needs fixing, you just want to know that you're going to put your time, effort, and money and get good value out of it. You're going to get many years out of it. Now, there are lots of situations, and sometimes I have a patient that comes in with a severely compromised tooth, and I have to tell them I can fix it, but it will be compromised. It's not a good tooth. Let's talk about replacement. More expensive, but something strong. And sometimes I get a patient in with a very small problem, very easy to fix. I can tell them it will last a long time just because it's a very small break, something like this. And I can tell that patient to have a higher expectation of longevity if they take care of it. But bottom line, if you have work in your mouth and you take care of it by flossing at night, brushing your teeth, limiting the sugar intake that you sip on or intake, the restoration will last a lot longer. If you'd like to see me in a professional manner, here's my information. You have a good day.